I see it in the press, I hear it all over the place. You don't understand this project. These people can be dangerous. But what I notice is nobody comes to the Staten Island Mental Health Council. Nobody ever asks us for information. The city does. We're an advisory body. But you know, when I read articles, they always have somebody quoted who's not actually a member of the Staten Island Mental Health Council. Sometimes they're members of different groups like OMRDD, where they have very different needs and viewpoints as to the kind of housing that those challenged by mental illness need. And we just, and I'm always curious when I see articles, experts, thoughts about things, but nobody ever comes to the fact that we have all the experts residing in Staten Island and members of the council. We send letters, we offer to give advice to the newspapers, to any of our officials, anybody who needs information about a project, information about people challenged by mental illness, and our door's not knocking. So it doesn't surprise me when I read these things that they find people who say things that go along with the gist of the article or the gist of the thought, because that pretty much makes their case. But there is no case for the fact that we added no new housing in 2009, and we are going to add housing in 2010, because we not only have 100 people sitting, we not only have people in transitional housing that's very expensive, that's only exists to get people ready for the next move, but we don't have that next move. But we have a crisis developing in New York City that's most certainly going to touch us here in Staten Island. And that's the adult home ruling that many of us know about. Okay, we know that it's been held up. We know OMH is contesting it. We know, but I'll tell you this, the consumer groups don't want to contest it. We know what the adult home ruling was? No? The court said that those challenged by mental illness and the adult homes aren't being well served, and that we have to get them out. They have to go into housing that's more suitable for them in the community. But if the housing doesn't exist, we have no place to put them. Now, if you read the blogs in Staten Island when this article first came out, you'll see that everybody has ideas where to put those Staten Islanders challenged by mental illness. Put them in Brooklyn. That's what they said. Oh, they'll have to go over the bridge. If we hold up the projects, if we don't build the housing, if they get out of the adult homes, they can go live somewhere else. That's what they say on the blogs and the letters. This is what people think, because they don't know any better. We need to educate them. That's one of the things we need to do in 2010. We need to go around and educate people. You know, we do something in our system where we educate staff about stigma. And it's a funny thing about doing that. When you do that, you start to realize that if the staff at mental health facilities aren't completely with it, with stigma, don't know how it can affect their own jobs, how it affects the community, why do we expect that the community would know any better? It's not the community's fault if they don't know any better. And it's not the elected officials' fault if they mirror what they're being told by their constituents, because they answer to everyone. They don't just answer to us. We do represent a lot of people in this room. Okay, we have families, we're at providers, we have clients. We represent thousands of people in Staten Island. If we wrote letters, if we made phone calls, we can make a big difference. But the reality is, one other thing we need to do is start getting out in the community and start letting the community know who we are. We need to get out there and we need to speak. NAMI has a great program in Your Own Voices. I went to a presentation once that they did at the College of Staten Island. It's very important that we get the consumers out if people are going to start to realize that housing for people with mental illness is the safest housing they can get. I've met with people when we were talking about certain projects in Staten Island where they said, we're afraid for our kids to walk past that building. And it's a funny thing, when we show them the statistics, the reality is you need to be afraid when you walk past all those houses with the shades drawn down and you don't know who's living in there. Last time I checked, nobody in this room got to pick their neighbors. Nobody in here got to pick who buys the house next door or who rents the apartment next door. So we need to start to change the thinking. We don't need to fight about it. We need to educate people. about what these projects mean, what this housing means? Because we know that the only way to recover, and recovery is a big thing we can do, right? That wasn't always something we thought about, recovery, when we were challenged by mental illness, but we know it's possible now. And what we need is good places to live and jobs. That's what everybody needs, and it's no different for us.